Okay, good evening and welcome everyone to the Catalan Cymru revision sessions. The session this evening will focus on psychology at A2 level and will be presented this evening by Miss Sophie Bellis from Allen School in Mold. The session will last around 45 minutes and will run through the relevant content with you. If you have any questions during the session, please use the question and answer section and we'll do our best to answer your questions. You'll see that there's a hyperlink in the Q&A section right now. If you're happy to leave your name and email address, we would love to keep in touch with you so that we can send you information about future events. You can click on the link at any time during the session. Today's session will be recorded and the recording and any relevant resources will be uploaded on the e-sgol website under the Catalan Cymru tab. So for now, over to you, Sophie, and thank you.
Thank you very much. Okay, guys, so today within this A2 psychology session, we are going to be focusing on Unit 3 behaviours unit of this A2 course. And in the last session, as you can see on the screen, we started looking at the different socio-cultural factors of schizophrenia. So we looked at urbanicity and how our environment has a really big part to play in whether or not we are diagnosed with schizophrenia. Today's session follows on from that really and very much still agrees that the environment plays a massive part in influencing our mental health, but we are looking a little bit more at families and the different types of families that people can be in and the influence that they have. So we're going to look at the double bind theory, and then we're also going to look at Brown's theory of expressed emotion and try and understand why relapse rates in schizophrenia are so high. At the very end of the session, I'm also going to go through parts of the evaluation of this as well, and I also have an example evaluation answer as well for us to have a look at. Okay, starting off with some background into dysfunctional families and where all of this began. This is a really good place to start in an essay. It allows you to introduce the background research and evidence that you can then develop on throughout your answer. So your first researcher that you have is actually a psychoanalyst. So she is a firm believer of the Freudian perspective of psychology, and you'll probably be quite familiar of her name because she is also the researcher that created something called the schizophrenogenic mother, and it's that theory that underpins the individual differences explanation of schizophrenia. It's the idea that the way that your mum treats you has a really impactful sort of part to play on your mind and how you deal with current situations. So Frieda from Reichmann suspected that the relationships we have with our family members could be the catalyst for the development of schizophrenia. She really honed in on the fact that it's a relationship between the child and the family members that influences these sort of psychological vulnerabilities. And although the major concepts of the psychodynamic approach are declining in popularity, and they definitely were by the 1950s, the idea that family relationships could be a causal factor remained a popular and credible idea. Now, we know that lots of Freudian theory has been debunked over the years because it is so subjective and there is a lack of scientific evidence to back it up. But what has stayed is that sort of backbone to his theory that everything that happens in your childhood influences you when you're older. That is pretty credible, actually, from Freud, who'd have thought, and that's definitely been brought into lots of psychological theory today. So although this is social psychology, the underpinnings of this is psychodynamic. And that's quite a nice thing to recognise at the start of an essay. Now, there's two different elements to this dysfunctional family explanation. You've got the double bind theory here in bold, and this idea of expressed emotion. And they are all to do with the ways in which your family members speak to you and just treat you really in general life. Okay, so starting off then with this double bind theory and the idea of having conflicting messages. Gregory Bateson is a researcher, and he proposed that symptoms of people that have schits were a result of communication difficulties in the family, especially between parents and their children. So much like Frieda von Reichmann, he puts the onus on parents and children. And he says that it's to do with communication difficulties. Schizophrenia may develop where a child is repeatedly exposed, and repeatedly exposed is quite important here because it can't just happen once, it has to be a continuous amount of conflicting messages. Repeatedly exposed to social interactions in which there are two conflicting messages, the child does not have the opportunity to ignore them or to adequately respond to them. So I'm going to show you a little example of what Gregory Bateson means here. Okay, so if a father tells his young daughter, "I'd love to hear what you did in school today," but at the same time he is watching the television and he isn't actively listening to her, pointing his body towards her, nodding, paying any attention to her really, it means that the daughter is receiving two conflicting messages, that he is interested in what she's done today, but at the same time he's more interested in the television. So the verbal component that's offered suggests care and interest and shows quite a nice, strong relationship between the two people. But on the other hand, the non-verbal suggests the complete opposite of that, and that's where that contradiction comes in, that the daughter is of less importance than whatever is on the television. And it's that kind of contradiction that Gregory Bateson is saying that could possibly lead to a psychological vulnerability like schizophrenia. Why? What's the background towards that? Because I'm sure you're all thinking, well, I think that's probably every parent in their life has done that. Just asked you something about your day, but been busy doing something else. It doesn't mean that we all have schizophrenia. And again, it's remembering that this is repeated, this is constantly over time. And also it's in your childhood when you don't have that free will, you don't have that sort of ability to recognise you're having a contradictory message and say, you know, "Oh, Dad, you just asked me how my day was and now you're not listening." Children don't have that part of their cognitive ability yet, so they're unable to actually comment on what's happening. So Bateson says that the communication contradictions incapacitate the child's ability to respond effectively. They don't know what to do, essentially. They don't know how to respond because the verbal and the non-verbal messages completely cancel each other out. And due to the child being so reliant on the parent, so remember, we are talking childhood, they are young, they are unable to meta-communicate. So they can't comment on the fact that contradictory messages have been used. Metacognition or meta-communicate is knowing something about yourself and recognizing that something's maybe not right, or that you know something that you don't know, knowing what you don't know is called metacognition. So meta-communicate is being unable to say, actually, Dad, you're giving me a contradictory message here. They don't have that ability yet. So, and I know that this sounds silly really, because if this was completely true and there was lots and lots of evidence on it, everybody would probably end up being diagnosed with schizophrenia. And it does kind of make you think, wait, what is that? Is that all that needs to happen in my family? And although yes, it does sound very, very far-fetched, Bateson is really, really clear that this is a factor. Okay, it's just something that influences it. So the bottom bullet point reads, Bateson was clear that this was neither the main type of communication in the family of schiz sufferers, nor the only factor in developing schizophrenia. So it is just a contributory factor. And it's something that could later on maybe spark something biological. I'm sure that most of you are aware of the diathesis stress model. The diathesis stress model is the idea that you can have a biological vulnerability but not develop schizophrenia until something in your environment has triggered it. And maybe double bind theory and this relationship with a parent is that trigger that then sparks something biological to then lead to schizophrenia. So although this is, you know, it can be a bit strange, it's that bottom bullet point that's really, really important here, that it's just a factor. Okay, so linking it to the symptoms of schizophrenia. So how does that actually develop into hallucinations, delusions, and losing touch with what's real and what isn't? Now, Bateson does claim that this is long-term exposure. And obviously, he says prior to this that it's got to happen lots of times. Again, it's got to be long-term. And it means that the child perceives the world around them in terms of contradictory input. They're unable to discriminate between contradictory messages. If you have this from when you're a young age, we know that it will impact you when you're older. And if you are contradicting and you're having contradictory messages, sometimes you can internalize that, and it can actually be something that is brought throughout your whole life in every situation that you're brought into. And that would mean then that you've internalized the double bind situation. And Bateson believed, remember et al is and others, so it was Gregory Bateson and others, believed that this eventually led to the manifestation of symptoms of schiz, so hallucinations, delusions, as a means of escaping those contradictory demands of the double bind situation. Okay, so that's how he linked it to schizophrenia. Okay, a quick overview of that double bind theory before I move on, because I know that there is a lot to this. A really nice place to start would be with Frieda von Reichmann and the fact that she believed it was to do with the mother's influence on childhood. Yeah. And then talking about Bateson's main theory. Bateson really is your only researcher for this double bind theory, which is quite nice. Obviously, you can bring Frieda von Reichmann into your introduction, but it's about those communication difficulties, having two conflicting messages. You can't ignore them and you can't respond to them. There's a really nice example there, which you are more than welcome to bring into a question. All that does to the examiner is helps you solidify your understanding and really show that you know exactly what you're talking about. And then it's linking it to meta communication and linking it to those symptoms of SCITS. So there's 5 steps really, isn't there, that you need to be able to do in order to really get this theory across to the examiner. Okay, so moving on a little bit then to the idea of expressed emotion. So you've got your double-bind theory as your first part of this dysfunctional families explanation. Second part is expressed emotion, or EE. I will probably refer to it as EE throughout this, and you can refer to it as EE in an essay as long as the first time you write expressed emotion, you write it out fully, abbreviate it in brackets, and then feel free to use EE throughout the whole rest of your essay. You just have to show the examiner that you know the definition of the term once, and it's normally the first time you mention it. Now, for expressed emotion, you've actually got a really nice study to learn. It's a really, really interesting study, all to do with relapse rates. Now, relapse means that you go back in time. So in this case, it will be men. He focused on a sample of men that have had schizophrenia and will have been admitted to hospital or a psychiatric unit for significant symptoms of SCITS. And he looked at them, Brown looked at them after they had been discharged from that. So they will have already had the treatment and then they've been discharged. And it's dependent on where they were discharged to that Brown is really interested in here. So sample is 156 men. And with that, I hope that that is sparking your ability to evaluate. So 156, pretty decent number, quite high really for a psychological study. However, not that representative in terms of the whole population of people that get schizophrenia. So when evaluating, you can argue that he hasn't really used loads and loads of people, but at least he's not used 10. So he's a bit in the middle. And also the fact that he has used men, that is a gender bias, isn't it? It's not really telling us about women that get schizophrenia and a discharge from hospital. So what he can't do is apply his results and generalise them to the whole population when he's used such a small amount of people. So he found that relapse, and whether you relapse and whether you got schizophrenic symptoms again so that you would possibly have to go into hospital again, it was strongly connected to the type of home that you were discharged to. So you'll have 2 different types of homes basically that he looked at. So there were wives or parents, so they went home to live with their wives or their parents, or lodgings. So lodgings would be that they would maybe live on their own or live with somebody that they don't really know, but it's secure housing that they can start to be independent in, or if they're with their siblings, so brothers and sisters. And they looked at these 156 men and they thought, right, we're going to have a look at where they went home to, and we're going to figure out which ones are more likely to relapse, because is it to do with the type of home that you go back to? And it is. He found that parents or wives were more likely to relapse if you went to live with a parent or a wife than those that lived in lodgings or with their siblings. And that's really interesting, isn't it? It's a really, really interesting finding from a piece of research. That why? So why is it? What happens in an environment around parents and wives that leads to them more likely to relapse and get skits again. Because if we know and if we have this information, well, it can really change where we send, where we discharge people to. So Brown conducted loads of interviews, okay, so it's an interview study with the wives and the parents, because he wants to know, what did you do? What was going on at the time? And he said that the relationship between the amount of expressed emotion and the likelihood of relapse. So the more expressed emotion, the more likely you are to relapse. And he grouped the different types of expressed emotion into different categories. But one thing I really need you to remember is that it's the more higher emotional, higher expressed emotion, equals likely to relapse. Low EE, less likely to relapse. Okay, so I'm going to go through with you now the different types of expressed emotion. Okay, so these are your components of EE. First up, critical comments, either about the behaviour of the individual with schizophrenia, and they were counted by Brown. So he would have been interviewing the parents and the wives, and almost like a tally chart, he would have tallied every time they said something negative or something critical about them. So things like they're really lazy, they don't help me around the house, I find them frustrating, they're annoying, etc. And he found that it was those critical comments that were made by those high EE caregivers. And remember, high EE caregivers equals likely to relapse. So obviously, I mean, everybody, this is quite straightforward, isn't it? Because if you've just been in hospital with schizophrenia and you've come out and you go home and people are making comments about you and have this negative attitude towards you, it is going to make you feel low. It's not going to make you feel good at all. And therefore, you know, if you're already psychologically vulnerable, it can lead to a relapse or somebody feeling worse, and then that possibly leading to a hallucination or a delusion, etc. Low EE caregivers, so the ones that were less likely to relapse, so this was lodgings and siblings, they tended to acknowledge that their behaviours were due to their illness. So, okay, they are lazy, maybe they don't help around the house, but it's because they have been in a hospital because they've got schizophrenia, and they're kind of a little bit more accepting of the behaviour that they see. Whereas parents and wives aren't, they're much more critical of it. So critical comments is your first type of expressed emotion that Brown found. Okay, second and third then, you have got hostility. So if something's hostile, it means that it's quite angry, it's quite aggressive. And hostility was noted as being present in the interviews with the high EE caregivers. So again, remember, high EE equals relapse. So the more hostile they were about or around the person, the more likely they were to relapse. So now we know that making critical comments and being hostile in an environment leads to schizophrenia relapse. So the hostility was thought to be a result of unmanageable anger, irritation, and ultimately the rejection of the patient, which I do understand in a way, because, you know, they have developed quite a severe mental health issue where they completely lose touch with reality. And if you are, you know, a wife or a parent of that person, I think a lot of it will be a bit of guilt and self-doubt. And I'm sure there is a lot of anger there for the person. Even if you don't mean to be, I'm sure there is something in your environment that would affect you in that way. So being hostile towards them equals relapse. And then emotional over-involvement, EOI. manifests itself in high levels of happiness and sadness, excessive self-sacrifice, and extreme overprotection behaviour of the caregiver towards the individual with schizophrenia. And this, again, seen in high EE caregivers. So very mixed signals, isn't it, in terms of behaviour and emotions, feeling happy but also feeling sad, being very overprotective. And it's mixed signals. It's those contradictory signals again, isn't it, really, that we've looked at with Frieda von Reichmann and Gregory Bateson previously. So EOI, emotional over-involvement, equals relapse. And then your next two that Brown found were warmth. So this was by looking and assessing the vocal quality. So as he was interviewing them, how were they speaking about the individual? What were they saying? Were they happy? Were they warm? Were they accommodating of them? Did they speak highly of them? Were they smiling at the time? Was there a little bit of empathy shown? And they found that low EE caregivers were the warmest about the person that had schizophrenia. So the more warmth you have, the less likely you are to relapse. So the slide reads, warmth was assessed by assessing the vocal qualities, smiling, and empathy expressed when the caregiver was talking about the individual with schizophrenia. Warmth was generally evident in your low EE caregivers. And that's really important because if from this research we know that low EE caregivers means that somebody is less likely to relapse, then we can use that. If we know a patient is going to be discharged from hospital and they are going to an environment anywhere, it could be friends, siblings, lodgings, parents, wives, whatever, we could probably put a bit of training in place. Right, in order for them not to relapse, you need to do this. You need to smile. You need to show empathy towards them. And just from, training the environment, we could actually stop the number of people that relapse with schizophrenia, which means that they are less of a strain on our NHS and on our health system. So this has, not only a social benefit and a benefit to the individual, it could also help people economically as well. So warmth is good, that's what we want. And then lastly, you've got positive regard, and that is the number of reinforcing statements that the caregiver expresses support and appreciation. So this is, just again, speaking nicely about them, saying that they're there to support them and that they're going to help them. It's that sort of really encouraging environment. And again, that is evident in low EE caregivers, which means that they are less likely to relapse if they are shown positive regard in their environment. So like I said before, warmth and positive regard, we could take that information and we could really, really use it as social psychologists to help people that have been discharged from hospitals with schizophrenia. So his research is actually really, really, really important, and actually taught us a lot about social aspects of your environment and how they can really influence you mentally. Okay, so going back then, I'll go back to here. So Brown studied 156 men after they had been discharged with SCITs. The relapse rates really strongly connected to the type of home they were discharged to, parents or wives, lodgings and siblings. He interviewed them all. He wanted to know what was it about wives and parents that made them more likely to relapse. We know it's critical comments, lazy, don't help around the house, and not acknowledging that those behaviours may be due to them being ill. It's being quite hostile towards them, so being quite angry and rejecting them. And then it's also showing them very, very different emotions, being happy and sad, overprotective, etc. And what it isn't is being warm around them and being empathetic and smiling when you're talking about them or to them, but also offering your support. It's a lack of support offered as well. So his research, really influential in understanding how we could possibly treat schizophrenia. Okay, so what I'm going to go through with you now is a little bit of exam practice. The exam practice question is actually an evaluation question of this rather than a describe one. And I've done that just so that you can see this from a different angle. So there's a few more researchers in here, and it's looking at, well, what would you say? What are the positives and negatives of dysfunctional families? Okay, so I know this is quite small on the screen, but this is an essay that a student did for me, and there are strengths to this and there are definite weaknesses to this study as well. But I'm going to talk you through it, and what I want you to think about is the points that are in the sort of thinking bubble at the side. So is there detail? Has the student included detail in their answer? Is there effective use of terminology? Have they used researchers? Have they explained the research well? And have they concluded, have they linked back to the question? Okay, so dysfunctional family explanation of schiz is made up of 3 sections. The first is the double-blind theory. Many studies have drawn attention to communication difficulties in the families of people diagnosed with schizophrenia. However, not every single study has found a significant difference in the quality of communications in these families that have a member that suffers with schizophrenia. Okay, very nice. So they've talked about that double-blind theory, and they've also said a possible issue with it, that not every piece of research that we've seen backs up the idea. So it says, in 1974, Joan Leem did a study and found that communications offered in a structured task by a parent of 11 sons with schiz were no more disordered than the communications offered by parents of 11 sons that did not have schizophrenia. Leem goes on to suggest that the studies that did find a difference in parental communications may just be seeing parents having to adapt their parenting and communication styles when dealing with a child that has schiz. The evidence suggests that the communication struggles in which the double-blind theory is based are actually more of an effect rather than a cause of schizophrenia. Now, I think that's quite a nice explanation, because what they're saying is that maybe the way you communicate with your child doesn't cause schizophrenia. Maybe it's an effect of knowing your child has schizophrenia, because I'm sure parents, that if they know that their child has got schizophrenia, they are going to speak differently to them. You are going to change the way that you communicate with them. And there's that problem of cause and effect. Are we causing the schizophrenia to start with, or is it making it worse, essentially? Now, one thing that I would say about this, although I would say, yes, there is detail, yes, there is terminology, yes, there are researchers involved, so there's Joan Leem, I definitely would make it more clear about that you're talking about cause and effect. So maybe up here you could say a possible problem with the double-blind theory is that we're not entirely sure if it's a cause of having schizophrenia, or an effect of having it. So I think that would let that paragraph read slightly better. Okay, second section then we've got is this idea that dysfunctional families is supported by expressed emotion. So there, this student is talking about Brown's study. Research done by Vaughan and Leff in 1976 indicated that the role of expressed emotion in relapse rates were extremely important in the cause of schizophrenia. Lovely. Vaughan and Leff found in their study that 53% of individuals with schiz who had high expressed emotion relatives relapsed in the first 9 months. although only 12% of those with low expressed emotion relatives relapsed. Okay, good. That is a really, really nice piece of research to back up Brown's study. Then they go on to say, not all pieces of research have supported expressed emotion as a predictor of relapse. So there's our problem, there's our evaluation. However, for example, Robert McCready and Carl Phillips in 1998 failed to find subsequent 6 to 12 months relapse rates among individuals with SCITs living in high expressed emotion. These findings would highly suggest that although EE may be a significant factor, it is easily not the only factor that determines relapse. Really nice point, really happy with that, because what they've done is they've explained the point in really simple terms at the bottom, and they've really linked it back to the question. So I would say research explained and little mini conclusion is definitely there here. So yeah, I completely agree. We can't say that where the person with schizophrenia lives is the only thing that's going to determine whether they relapse or not, because actually there's loads of different factors. So what this student could have done here is say that maybe we need to be slightly more holistic and consider lots of different elements of a person that could lead to relapse, instead of just saying, oh, it's only environment. Okay, so nice, but maybe at the bottom I would add in that we could be slightly more holistic. I think that that would really, really help to stretch the person to get right to the top of the mark band. The last section of the dysfunctional family explanation is the shared environment or shared genes explanation. This states that one of the biggest challenges for explaining SCITs is that although SCITs may be down to communication difficulties within a family environment, SCITs could equally be the product of the family's shared genes. So it's this idea that, yes, okay, it could be the way that your family speaks to you, but it could also be something genetic. And one thing that psychology doesn't do is considers that there are actually other factors. So whilst we're looking at the social explanations, they kind of exclude any other possible explanation, when really genes and biology are going to have a really big part to play in this. What the students done here is brought in a piece of research from the biological explanation. So it says, the Schizophrenia Working Group of the Psychiatric Genomics Consortium did a study in 2014 and found 108 genetic loci associated with schizophrenia. And what that essentially means is that there's 108 possibilities of genetic similarity. The evidence at first might initially seem to suggest a very contradictory viewpoint to the role of family relationships as a cause of SCITs. But on the other hand, using a diathesis stress model, it could be that family relationships may act as a psychosocial trigger that causes genetically vulnerable individuals to develop SCITs. Now, I think that's a really lovely point to finish this essay on, because you are essentially saying that, okay, yes, I acknowledge that there is definitely something social going on here and there's something to do with the environment, but we absolutely cannot disregard that it's biology that is the main cause of schizophrenia, because it's that influence of dopamine in the brain. So using that diathesis stress model is really, really important. Now, this essay, I would say, has got detail, it has got terminology, it has got researchers throughout it. I think the research is explained well, but I think that could be developed further. And I also think that it needs a really clear conclusion, either at the very end or just to develop some of these points a little bit. So I would say that this is around a 6 or a 7 out of 10. It's definitely near towards a 7 than it is a 6, because I just think in order to really hit that top mark band, they could expand on their points slightly more. Okay, so I really hope that that was helpful for you all. On the screen here are just some top tips different revision strategies that you can use. So creating a keyword glossary, you can use this PowerPoint to do that, as all of your key terms are either highlighted in bold, underlined, or in red font. You can write all of those researchers' names out and condense their research. So for example, you could say Brown equals relapse rates, high EE, parents and wives. Okay, that is really, really brief description of a really key piece of research that you need to know. And then writing down everything you know on a blank piece of paper, going over it, reviewing it as you go through to see what you don't know. That's called metacognition. And I know we've spoken about meta-communication throughout this PowerPoint too. And then it's making sure that you write an example essay. Write an essay like this, give it to your teacher, get some feedback, maybe write it again and again and again until it's perfect. So you know that you've got in your notes a really wonderful essay to then learn and use for revision. So that is your explanation of the double-blind theory. The next session next week that I'm going to talk you through is methods of modifying schizophrenia. So we're going to look at drug therapy and cognitive behavioural therapy as a way of treating schizophrenia. Thank you all very much, and I will see you next time.